everyone, I'm Dr. Tour from Amplify Eye Care here in Olympia, Washington. Today we're going to go over contacts for someone who's presbyopic, but also just known as typically over 40 years old that's having blur up close. So a lot of times in terms of glasses, that's when you see the bifocals coming into play, or just reading glasses. So typically with contact lenses, there are a few different things that we can do if you need to be corrected for both distance and up close. So first and kind of easiest is using your contacts to correct your distance vision, and then using just reading glasses over top of that. Other patients don't want to do a lot of the on-off with glasses, and depending on where they're looking. So the two other kind of most successful routes that we can go in terms of contact lenses, one is monovision. So that typically means that one of your eyes is focused for distance and the other eye is focused up close. We do a lot of testing in office to determine which eye is going to be doing what and just what you're comfortable with. This is pretty easy to adapt to in terms of your brain getting used to it, even though it sounds kind of funny. But the biggest thing patients notice is that your depth perception is off, because now both of your eyes aren't focusing on the same thing. So typically takes a few weeks of cautionary driving, things like that, before patients get used to it. But it is wildly successful in terms of what your brain can get used to in terms of your two eyes doing different things. Of course, there are patients that just are not going to get used to it. And then there are other contacts we can try, such as multifocals. So that's kind of similar to almost having your progressives or bifocals, where it's all in the one lens. But this is done a little bit differently. So both of your contacts are focusing at distance and up close. So that usually means that we have to compromise a little bit of vision in both. There might be some ghosting or shadowing that patients might notice at first, but depending on kind of your fitting, your prescription, we can get pretty good vision for both distances. Again, it just depends on what patients prefer, what they like. We usually test out what I do first is I try monovision. And if we're not having success with that, then I go to multifocal, unless of course the patient has different needs and we need to do multifocals from the beginning. This is kind of a discussion we have to figure out what your goals and needs are, and then determine what's going to work best for you. And then we initially try a fitting pair, and then can adjust the prescription a little bit to fine tune it to exactly what you need. So there are options in terms of contact lenses for patients over 40, 50, 60 years old. They're just a little bit different in terms of the fitting and the vision that you'll get.